My name is Dan Jones. I'm a professor at Michigan State University in the USA. My research focuses on a technique known as metabolomics. I visited Jaseng Hospital to develop a collaboration to understand more of the scientific basis of how their treatments are alleviating pain and treating disease. While I was visiting Jaseng, there were several things that I found really remarkable. First was how successful and how rapid they found success in alleviating the acute pain of the patients that I saw treated. This is phenomenal because most treatments of acute pain, and back pain in particular, are notorious for their lack of success. The other aspect that has been very impressive is the medicinal treatments are operating at so many levels. They're operating at a mechanical level on the patient's spine. They're operating at a sensing level on the patient's nervous system through acupuncture. There is a biochemical treatment that involves medicinal herbs. And perhaps most important, there is the personal and psychological portion of the treatment that involves engaging the patient in motion and exercise. There are two aspects of this. One is that they're putting on a performance, that they're becoming the stars for their physicians and for their families and the other people who are in the clinic. And I think that gives them some pride in their own recovery that perhaps leads to that recovery being more successful. So the motivation of the patient has a lot to do with success. I think that's recognized in both Eastern and Western medicines. Westerners often expect that the physician is just going to cure them and that they have no role in their own health. And the procedures that I've observed at Jaseng are more involved in applying techniques but then engaging the deliberate interaction of the patient to take steps toward their own recovery and health. The last aspect that impressed me immensely was how Jaseng's procedures treat the patient comprehensively. One thing that I observed yesterday was that the procedures that were applied to patients often started at remote sites from where the pain was. Dr. Shin would treat a patient who had problems with knees, but by going to muscles elsewhere connected to the spine, and by treating this, then it led to mechanical flexibility that led to better recovery, better function in the knee joints as well. In some physicians, certainly in the West, I have seen them focus on, if this is where the pain is, this is where the treatment is, and we won't deal with anything else for the time being. Here, the treatment is more inclined to ask, what's the cause of the pain and the lack of motion, and where do we go to treat that first? And once you treat the most severe problem, then you move on to find the secondary and tertiary problems that need to be treated afterwards. We know that living things function as networks of connected, complex events. Treatment of human disease is emerging to exploit such treatments using a more global and holistic treatment of the whole patient rather than just treating symptoms. We hope and anticipate that the science that we develop underlying these treatments will help lead to improved treatments of patients around the world for years to come.